Good afternoon to everyone. Participants are still joining, but I think we can start now. So welcome to Let's Talk Nutrition 2.0. Before we begin, let me just say a few words regarding this initiative. So it's basically a scholars and student-led initiative. It started from ICMR NIN, and now we are trying to broaden our community. The sole objective is to spark meaningful discussions in the field of nutrition and to build a community. So our previous event was an offline event here in Hyderabad with Dr. Su. And after like so many requests for an online session, we are fortunate to have Professor Pulkit Mathur with us. I mean, we all have studied her books during our bachelor's and master's courses, and she's like an icon for all of us. And it's a great pleasure, ma'am. Thank you so much for accepting our invitation. So for this event, we have partners. Our media partner is the Healthy Indian Project, HIP, which is a fact-checking organization. And they aim to deliver credible health information to different channels, like they have their blogs, journal, magazine, and also through their social media handles. And also our event partner is NatFirst, which is a product intelligence company. They have a app called Truthin, which helps us decode labels. So if you have any kind of doubt regarding the packaged food that you are consuming, you can scan that product using Truthin app, and it will tell you whether it's good for you or not. So with this, I'll invite Aditi, who is an MSc student here at ICMI to introduce ma'am formally. Of course, she doesn't need any introduction, but from our end, we'll do it. Aditi, please.
Hello, everyone. A very good evening to all the esteemed participants who have joined us today for Let's Talk Nutrition 2.0. It is truly my honor and privilege to introduce a distinguished academic and inspiring personality whose contribution in the field of nutrition science have left a profound impact on students, the researchers, and the public health initiatives alike. We are joined today by Professor Dr. Pulkit Mathur, a leading figure in the field of food and nutrition. She currently serves as a professor in the Department of Food and Nutrition at Lady Irwin College, University of Delhi. Beyond her academic responsibility, she holds several national and international roles of great significance. She is the Joint Secretary of the Nutrition Society of India, a member of the International Scientific Committee of the Choices International Foundation representing South Asia, and a national resource person for the FOSTAC program of the FSSAI. In addition, she is also a national trainer for nutrition under the Rashtriya Kishore Swasthya Karyakram and serves on the scientific panel on the nutrition and fortification at the FSSAI. Dr. Mathur is also a gold medalist from the University of Delhi with more than 100 publications to her credit, including research papers, manuals, books, and periodicals. Her contributions have been recognized with a certificate of appreciation at the Eat Right Awards, as well as a certificate of merit from FSSAI for her efforts in strengthening the food ecosystem. Previously, she has served as a member of International Union of Nutritional Sciences and was the part of National Task Force on Balanced and Healthy Diets under the Directorate General of Health Services. With deep admiration for her academic excellence, public health leadership, and unwavering dedication to nutrition science, it's my great pleasure to welcome Dr. Pulkit Mathur to this session. Welcome, ma'am.
Thank you so much. Thank you so much. It's a great pleasure to be here. I was once a PhD student at NIN, so this brings back fond memories. And, it's a very warm feeling to know that the youth of today are heavily into, good health and wanting to talk about nutrition. So it's indeed a great pleasure for me to come and talk to you about ultra processed foods, and why are we looking at them and why singling them out in our crusade for a healthy diet. I'll share my PPT. I'm going to switch off my video for the talk so that there's better bandwidth available. I can see there's a lag in the video and the talk. Okay, so just give me a moment to share my PPT.
Yes,
Are you able to see it now?
Yes, ma'am, it's visible.
Okay.
Yes.
Okay, so what I'm going to talk to you about is trying to address the raging debate that we see nowadays in the media and in professional circles and scientific talks on the ultra processed foods, and what is the current research evidence that we have for understanding how they impact our health and nutritional status. So, when we look at what is the difference between what is called natural food, which is being promoted, and what is called processed food in lay terms and being put down. So you have this whole industry debate where they say everything is processed, and how can you say processing is not important? And to solve these kind of debates and issues, we follow the NOVA food classification system, which you may be aware about, where it's the foods are divided in 4 levels of processing, where group 1 is the unprocessed or the minimally processed foods, where you're eating foods just as is, or doing simple kind of processing like drying, grinding, roasting, pasteurization, refrigeration, simple kind of things, which is not really changing the nature of the food, but it is just making it ready for you to consume. Group 2 is the processed culinary ingredients. Now, these are the things that you would use for preparing food. So the vegetable oils, the butter, the sugar, the honey. So they are undergoing some amount of processing like centrifuging or refining or extracting, etc. But this is what you will use to make processed foods. That means group 1 and group 2 together will make the processed foods. And these have been defined as, you are doing minimal processing like canning, bottling, or smoking, or even making things like breads or cheeses. But these are the ones where you are not really putting too much of the additives. Maybe you've put a bit of preservatives, but this is not something which is having a lot of these industrial use ingredients. So the ultra processed foods belong to this 4th group, and there's a lot of debate on how this unpackaged fresh bread in your bakery is coming in group 3, but the one which is available in your in packets for mass sale is actually a UPF. Now, the difference comes from the use of industrial ingredients, industrial processes, which are much more complicated than simple processing as has been defined above. So here would be produced foods which don't look like their original, constituents or ingredients, because they have undergone certain industrial processing, which is typically not done at the household level. So what you see are these commonly consumed food products, which include all your namkeens and your chips and different kinds of, sugary, sweet confectionery and cookies, and so many kinds of things that we are now regularly consuming in our diet, and they all come under the category of ultra processed foods. Now, what is so wrong with these ultra processed foods? What's the problem if we consume them? The problem is that these are now increasingly being linked to the increase in obesity. Now, if you look at the World Obesity Atlas data, this is a 2023 report. These 4 curves denote, so dark blue is men, the red curve is denoting women, the light blue curve is denoting boys, and the yellow curve is showing you the girls' data. And this is from 2020 with a projection of up to 2035. And you can see all curves are going up, and it's a steep increase. In fact, the increase in obesity worldwide has been, the risk is, and the consequences are all rated in red color, which is high to very high level of concern. If we look at our own Indian data, and this is NFHS 5 data on presence of abdominal obesity. Now here you will see 3 colors. The darker orange color is denoting very high prevalence, and you all know already that abdominal obesity is the worst kind of obesity and increases the risk of all the NCDs much more. Very high prevalence is described as more than 50%. Then there's a lower shade of, lesser orange, and that is a high prevalence between 30 and 50, 35 and 50%, and then the yellow color, which is low to moderate prevalence, which is less than 35%. So you can see in red are states of Jammu and Kashmir, Punjab, Delhi, Haryana, Uttarakhand, Sikkim, and in the south you have Andhra Pradesh, Tamil Nadu, and Kerala. And the other bigger states are also not far behind. So they are also having high prevalence, which is 35 to 50%, which means 1 in 2 people are obese. This graph infographic is showing you the number of deaths from cardiovascular diseases in 2021. This is in the report of 2024, so the data is of 2021, and the red color is what is showing you countries with a death rate of 300,000 annually. And you can see that India very much falls in this range along with all these other countries, including the US and smaller countries as well. But you can see that here India and Pakistan and China, in fact, also, all of us are falling in this range of a large number of people dying from cardiovascular diseases. Similarly, prevalence of diabetes in India, you can see how the graph is going up as the years progress. And this is again a red flag where we really need to look at what are we eating. So agreed that most of these diseases are multifactorial etiology, but everyone will agree that diet actually plays a very vital role. And globally, this is not just in our country, but globally there is a trend. Globally, there is a call to shift to minimally processed foods and to have more of plant-based diets because of the increasing evidence of UPF and the other things in the diet which are contributing to obesity. In fact, there's a very interesting session which happened. It was a hearing which actually happened in the UK Parliament a year ago, and that was on link between food, diet, and obesity, where they had invited leading scientists from all over the world to actually, जैसे गवाही देते हैं court में, that kind of a hearing where they presented the evidence which was linking diet and obesity. So it is, of course, you can say obesity is because you're not exercising and you're not spending enough energy, but these studies which were presented in this hearing were linking diet and obesity. And I'll be coming to some of the studies which were presented, but those of you who are interested, this is available on YouTube. You can just look it up and listen to the proceedings, because it's very it's a new experience to see how a parliament is going about looking at the link, and hence this then leads to their national policies, the kind of decisions they take in a parliament. Here's to share with you some of the studies that we have done at Lady Irwin College. And the first study which I'm showing you is by my PhD scholar, Shrishti Mendirata. She worked on nutrient profiling, and at that time also, well, it's still not out for India, but there was this whole thing of which model is going to best suit, if we look at international models, which is the best model we can use for profiling different foods, and I'm trying to identify which are the foods which are high in salt, sugar, or fat. So what we did was we looked at about 8 supermarkets and also picked up data from online, these suppliers of grocery. We also looked at quick service restaurants all over Delhi. And ultimately, she had data for about 322 packaged ultra-processed food items and about 79 freshly prepared foods, which were the most frequently consumed in the city. Then she compared 5 different profiling models: the FANS model from Australia and New Zealand, the PAHO model, the choices, the traffic light scheme of UK, and the WHO model for Southeast Asia region. Now, this is just one of the slides I'm showing you from her paper, which is showing you how many products actually exceeded the salt threshold by the different profiling models. So here the bars which are in gray are representing ready-to-eat savories, which includes all your namkeens and your chips, etc. And the green bars are showing you the prepared foods, which means all the quick service restaurants and the kind of foods that people pick up from these quick service restaurants. And you can see that both these are, 86%, 81% of the foods, 86 and 96% of the foods are all showing that they have too much salt in them. Similarly, there are others, and I'm not putting all the bar graphs here, but most of the foods which were being sold were exceeding the salt or the sugar or the fat thresholds or all three thresholds. And out of all the food categories, it was the bakery and the confectionery products, the ready-to-eat foods and the desserts, which were very high in fats. The beverages and the desserts were high in sugar. And the prepared foods, the ready-to-eat foods, as we've seen in the bar graph, were high in the salt content. What this highlighted was that, it's not just the packaged food items which need to, be looked at and reformulated, but also all these food service establishments who are serving you these quick meals, which people are, consuming as snacks or even entire meals throughout the day or even regularly once a day. And that is what is going to put our population at a great risk with the increase in number of people eating out. Now, this is a slide, again, the same scholar who also then mapped what was the intake of different nutrients in the diet, and she also quantified what was the contribution of ultra processed foods to the total macronutrient intake of a individual. So the group she worked with was the income group and the young adults, and we found that about 17%, so the blue bars are the total numbers, which is about 600 people she covered. Orange bars represent the males and the gray bars represent the females, and you can see that for energy, about 17% of the energy in their diet was coming from ultra processed foods. And similarly for total fat, carbohydrate, protein, added sugar, and sodium, you can see 1/3 of the sodium is coming from the ultra processed foods, and again 29% of the added sugar in their diet is coming from the ultra processed foods. Another one of my scholars worked with adolescents, and she looked at two income groups, the low and the middle income families, and she covered about 1,000 adolescents. This is all published data. The adolescents were aged between 12 and 16, belonging, and the way we did the low and middle income group was to look at the private schools and the government schools. And here also, when we mapped how much of energy is coming from ultra processed foods, we found up to 16% of their total energy was coming from these ultra processed foods. And the children who were from the middle income families were consuming significantly higher amounts of these of all these macronutrients from the ultra processed foods as compared to the low income families. Now, if we look at or try to compare how much does this compare against, some developed country, and how much of ultra processed food are they consuming? Well, they're consuming much more than us. So Korea, about 25% of their diet is coming from energy is coming from ultra processed food. Australia, it is 42, and the United States, it is 58% of their total energy intake. Now you may say, okay, hamara to kam hai, we are still okay. We are not still okay, because you have Euromonitor database, you have many databases. In fact, WHO has recently taken out another guideline or document which shows how much of ultra processed food is now growing in India. The rise is expected to be greater from things like carbonated beverages, biscuits, sweet and savory snacks. And unless we do something to arrest this very sharp rise which is happening in the consumption pattern, we are headed for all the troubles that the developed nations are currently going through. In fact, we have greater trouble than them because of our constitution and the way we react to this kind of food. This is another scholar of mine who worked with adolescents, and she mapped how much, say, during the past week, how frequently were they having healthy foods as well as HFSS foods and beverages. Now, here the orange color is showing you more than 3 times a week consumption, which is a regular consumption. So, if you look at the healthier foods, they are having vitamin C rich fruits and vegetables, or yellow and orange colored fruits and vegetables, green leafy vegetables, other fruits and vegetables. So but between 60 to about 76%. But you can also see that there is regular consumption of all the unhealthy or HFSS foods, which is happening, and that it's happening on a regular basis. It is also once or twice a week, which we typically say that, okay, once a week if you have it doesn't really matter. But if once a week I'm going to have this and this and this and this, then it adds up, and almost every day you're going to be having something or the other which is not good for your health. So HFSS foods as a category, if you're having once or twice a week, then you say that nutritionally actually it doesn't have an effect. But if you sum it all up and say separately, then it is not so good an idea to be consuming something or the other every single day which is high in fat, salt, or sugar. She also looked at barriers and facilitators to healthy eating among adolescents. Among perceived barriers, they said that basically they liked seeing and like trying foods that they saw a lot in ads. So they did see an ad of a particular food, they did want to try it. And when they did try to eat out, the menus were lacking healthy options, so they were forced to pick the unhealthy options. Food was more like a reward or a mood elevator. So when they went out to, in quotes, enjoy, they wanted to have foods which brought them pleasure, and those were the HFSS foods. And then there was this barrier of having this thing that they have to have a better body image, and hence they are sticking to fat diets, which are then again leading them to unhealthy eating. So this is not HFSS, but this is more like unhealthy diets, because they are getting onto these fad models of dieting in order to have a better body image. But facilitators were things like, they actually said that they preferred homemade food, and for many days if they didn't have it, then they were actually yearning for homemade food. Then the ability to be able to prepare a healthy snack for self when parents were not available. So when you're hungry and you look out for something to eat, if you're not able to whip it up yourself because nobody else is there to give it to you, then the tendency is more that you reach out for unhealthy snacks. Then family meals, they said, encouraged healthy eating. Parents were a role model. If the parents themselves were eating unhealthy foods, there was no way the children were going to eat healthy foods. As the school encouraging healthy eating was a perceived facilitator. And this is like setting what is cool, kind of a trend in schools, among peer groups and among the teachers who are highly respected among the junior students. So it is important what the school encourages and would help or facilitate in adolescents into eating healthier. But when we talk about healthy eating, we do need to look at what is our food environment. This was a very interesting cartoon which I saw on the internet, where food environments have been put together in the single image. The social media, if you can see, the girl is looking at her phone, so whatever is being flashed at you, that is what you want to eat. If you go out into the market, the kind of foods that you will see tend to be all food outlets which are selling you HFSS foods. If you go for the packaged foods, you will see the discounts, buy one get one free kind of things are all for HFSS foods. If you have limited money and you are out to buy something in that limited money, you will see that the HFSS food is much cheaper than a healthier alternative if you want to pick any of those. I also want to show you this image, which again depicts that there is a huge penetration in the market of all these HFSS foods and snacks, which are so readily available even in the far-flung rural areas. So whenever there is a crib of, oh, we can't reach these healthy foods and the supply of these vegetables and fruits and all to the interiors, it's quite sad, because the industry has penetrated these markets, and you can go to any corner of the world, even if it is the highest point in India, where, if you go to Leh Ladakh, and nothing will be available there, but you will have this fellow selling Maggie on a glacier, and that'll be the only thing you can get to eat. So what I'm trying to say is that our food environment, the market, the accessibility to healthy foods is also very limited, or it is very expensive. And what is actually flashed and available easily to you is all these foods which are HFSS. This is a latest article from the Lancet, which is quantifying the regional variation in the ultra-processed food consumption, and they did it across a few countries of South Asia. So they took Pakistan in the Punjab area. They did Bangladesh, Sri Lanka, and Chennai and New Delhi from India. And they found that the UPFs are contributing to about 13 to 17% of the total energy intake. The sweetened beverages in Pakistan, the salty snacks in South India, breakfast cereals in Bangladesh, and biscuits across all the regions were found to be the most commonly consumed foods. Moving on to a question, we know all this is bad for us, and so how do you communicate with the general public? How does the layperson know what to eat? That is the function of dietary guidelines of every country, where they are supposed to address these issues and communicate to the general public of what is to be eaten. So just a quick look at how these dietary guidelines are addressing the processed or the ultra processed foods. Now, you will see across guidelines, in many different countries, that they do talk about consuming freshly prepared foods as compared to ultra processed foods, but those words don't come in most of the guidelines. So the golden rule is of this, that you eat more of minimally processed or unprocessed foods, and freshly made foods is there, but you see very clear mention of don't have ultra processed foods only in 2021 dietary guidelines of Brazilian children, of certain Latin American countries, Israel, Malaysia. The High Council on Public Health of France also talked about a 20% reduction in UPF. You have the American Heart Association, which is talking about it, where they have given guidelines for improving cardiovascular health. The EASL Lancet Liver Commission has also talked about reducing UPF to prevent liver diseases. Of course, Brazil was the first country literally to talk about it, talk about the different levels of processing and in their dietary guidelines. The American dietary guidelines do not talk anything about processing. They're just talking what most guidelines say about nutrient dense or good foods like vegetables and whole grains, and kind of reducing foods which have sodium or sugar or saturated fat, but there is no direct reference to the level of processing. So ultra processed food really is not appearing there. So most of the guidelines you will see are talking, can eat less of the negative nutrients, eat more of these foods which are good for you. Thankfully, our own dietary guideline is very clearly talking about minimizing the consumption of HFSS foods and of ultra-processed foods because of their link to these non-communicable diseases. There is a whole review article which is there, which has looked at 106 dietary guidelines across the world, and you can refer to this to see how these messages are going across in different countries. 99% of the guidelines, however, are nutrient-based messages and not talking about food processing. So there are very few of these guidelines which are looking at it, and out of the ones which are looking at processing levels, 53% are talking about eating less of UPFs. This is just a diagrammatic representation of the same. The last two bars on both sides, so left side is eat more of, right side is eat less of, and the last two bars are talking about whether the processing is implied or processing has actually been mentioned. So in eat less category, 45% of the guidelines are talking about it, but in the eat more category, only 5% are talking about it. Now, this increasingly, this whole talk about avoiding UPFs is supported by a lot of scientific evidence. So it's not something which always the industry kind of alleges and says, this is just a thing that you're making up. There is a lot of scientific evidence. It has been generated in low, middle, and high income countries. And basically, what the evidence links these NCD effects is because of the poor diet quality, which is leading to increased morbidity and mortality in most of these countries. There is, however, a counter argument to all this, and there are papers, and you will see them when you do a literature review, that there are papers claiming that it has nothing to do with the processing and it has everything to do with whether the food is high in fat, salt, and sugar. And hence you will see these kind of articles which have actually developed menus for a healthy eating, dietary pattern, where they have used ultra processed food. So they are saying that you can have a healthy diet using ultra processed foods, and they have kind of gone ahead and proved it. However, more articles, many more articles, in fact, I mean, there's not even a ratio. So it's majority of your articles are talking about the trouble there is in eating ultra processed foods. And this is probably linked to them being very convenient, ready to consume, very affordable, hyper palatable, all three features making them foods which you would over consume. Okay, if you over consume, and that's how they are linked with obesity. In fact, in that hearing, the UK hearing, which I told you about earlier, they have quoted this article, which is looking at systematic reviews and meta-analysis. I'll show you those articles, but if you look at them in toto, you will see that UPF consumption is linked to obesity, type 2 diabetes, hypertension, cardiovascular diseases, and also mental health. So they are also linking it to depression and all-cause mortality, even to cancer. This is one of those systematic reviews which was mentioned in the hearing, and their main findings were looking at 23 studies which were cross-sectional or prospective cohort studies, where they have found that there is an increase in the risk of overweight, obesity, low HDL levels, metabolic syndrome, and increase in all-cause mortality in studies, depression, cerebrovascular disease. And this is another one which was quoted in that. So, the problem with cohort studies is you don't have a cause and effect relationship. So if you give only prospective cohort studies, then people have, question how UPF can actually cause these diseases. So what they did was they did a randomized control trial, and this is a very oft quoted study which is there of Hall et al. And in this randomized control trial, what they did was they took 20 weight stable adults, and they were admitted to a center where they were randomized into two groups, and they received either ultra processed diets first for 2 weeks, and then unprocessed diets for 2 weeks. Okay, and then they flipped both groups. They flipped over to the other kind of diet after 2 weeks. Now, this was to be had ad libitum, that means as much as you want or as little as you want. And they tried to match both these diets for presented calories, energy density, macronutrients, sugar, salt, and fiber. So the energy, so what they found was that when people were consuming the ultra processed diet, they tended to consume 500 calories extra, and they put on in those 2 weeks about zero 0.9 kgs. And when they switched to the healthier diet, they lost those zero 0.9 kgs which they had put up. So this was a randomized control trial which was directly linking it to weight gain. This umbrella review is also quoted very often, which links the ultra processed food exposure to adverse health outcomes. They have produced convincing evidence, which is called class 1 evidence, and highly suggestive or class 2 evidence, which is linking these UPFs to the different diseases over here. Now, the probable reasons why, or the mechanism, you may say, why UPF causes these diseases may be that because these are energy dense, they have high fat or salt or sugar, or they are poor in fiber, or they are micronutrient deficient. So, multiple nutrient imbalances present in such diets, or in general, poor nutrient profiles. This is from meta-analysis of national dietary surveys in 13 countries that they are coming to this conclusion. However, there are about 37 cohort studies which have also shown that if you remove this, this factor, that if the nutrient profile is somehow controlled for, you will still see an association between the ultra processed food consumption and these NCDs. Okay, so that is something which threw everyone off, because till now they were just linking it to the fact that UPFs also tend to be HFSS, but when they controlled for this poor nutrient profile, they still found that association. Now, what could be the reason, or what could be the mechanism by which these foods are still triggering all these NCDs? Then came these suggestions of whether it was linked to the additives that they have, or the food contact material which is leaching onto into the food, or is it newly formed compounds which are produced during processing? So you have acrylamides, and you have all these polycyclic aromatic hydrocarbons which are produced when you are doing all these kind of high heat processing, or whether it was the degradation of the food matrix, or lack of protective phytochemicals, or simply the addictive potential of these. Now, a lot of food additives are actually coming under the scanner, among which include the emulsifiers, the artificial sweeteners. They have all been linked to the pro-inflammatory potential of the gut microbiome, and also the link to cancer. So where does all this information lead us, you may ask? It leads naturally to the fact that we need to change the kind of foods which are available, which would mean that the industry needs to reformulate, as well as all the chefs and the food service establishments need to reformulate. Now, what is the answer to, okay, I am not going to eat so much sugar? The answer cannot be replace the sugar with an artificial sweetener. Similarly, reduce the fat in my diet. Let me put some modified starches, or let me put this food additive, or this kind of a processed ingredient, putting these extrinsic fibers. Let me make this drink healthier. I'm going to put all the vitamins and minerals into it. So this is not a solution. I would even say that when we go ahead and in our little projects and dissertations we do, let us make healthy cookies, and let us make healthy muffins. And what are we doing? We're just replacing the maida with perhaps atta or some other millet flour. But the amount of fat, the amount of sugar is still remaining the same. That is not a healthier alternative by any stretch of imagination, is my belief. We have to look at that as not a solution, putting different chemicals now into the food just to reduce one natural ingredient. So there's a whole lot, and I could at any other forum also speak on these food additives. A lot of my initial research work, including my own PhD, was on mapping the intake of food additives in our diet. And this is from a WHO report which looked at randomized control trials, which were showing that these sweeteners may reduce your body weight and BMI, but for diabetes, cardiovascular disease, and other things, they basically were not very helpful. And if you looked at the cohort studies, then they were actually increasing adiposity, increasing the prevalence of diabetes and all-cause mortality, actually. So what is a positive solution? If we can't do this, if we throw out the sugar, we can't add artificial sweetness, what should we do?